what can one do to prevent the formation of brain aneurysms? And conversely, what are the situations when the risk for the brain aneurysms and their development increases?
This is one of still in research phase to gain more knowledge as time goes. However, we do know few risk factors as most common risk factors that as a general population can learn to reduce risk of developing intracranial aneurysms. As we know that in general population, based on the autopsy data, probably runs about 0.9 to 9% of population might have a small intracranial aneurysms or aneurysms. Those are based on the 1950 to 1980s autopsy data. So obviously it's not perfect. You can't say this is definitely population-based, but this is meaningful. The truth is that the only certain small amount of these patients end up ruptured. Had a rupture aneurysm during their lifetime. So there are a fair amount of patients they never rupture.
On the other hand, if they do rupture, the mortality rate could be up to 50%.
That's exactly right. That's exactly right. So I think it's important to think that we know at this point, few things is quite a less debate at this point, is that cigarette smoking, uncontrolled high blood pressure or persistent high blood pressure without controlling, and also any factors that potentially promote the atherosclerotic disease, for example, the genetic factor, which is hard to determine, hard to change, but at the same time that control your cholesterol level, triglyceride level, I think that's additional meaning on this. But generally, I think is that anything potentially could compromise your coronary artery vessel, body vascular vessels, and the same will reflect on the brain as well. Therefore, as I emphasized before, that cigarette smoking should, I would say, should be the one thing that if we can eliminate it, easily alter our lifestyle to completely eliminate that. Blood pressure, you can control, or if you have a blood pressure problem, obviously with certain medications, you get a good control. And obviously, general health is that exercise always is meaningful.